Well, I am very excited to be spending time with you this morning. Uh, as you know, I'm a clinical and a forensic psychologist, and of course, a professor emeritus here at Nova Southeastern University College of Psychology. And I've been studying domestic violence for over 40 years. I knew when we faced this new crisis that we're in, having to stay at home, that this was going to be a terrible choice for many women who live under the threat of domestic violence with their intimate partners. For many of us, being home with an intimate partner can be a very exciting and loving event. It can even strengthen our relationship. But for some women, and maybe some men as well, it's a choice, a husband's choice, if you will, between being hurt by the violence or being hurt by a batterer. So today, what I want to spend some time with you doing is to talk a little bit about how we can reduce the anxiety and tension and need for more and more power and control, and protect ourselves and protect our clients. I know so many of you are working with clients, many of whom are going to be in this very sad situation. So we're going to try to do the best we can to help people. We know that children are at home. That's going to be tough for those of you who have your own children at home. And it's going to be tough for couples where there's tensions rise and anxiety rise. The first thing that happens is somebody gets angry and strikes out with either psychological aggression or physical aggression. So we want to be very careful about how we help these clients and help them know that there are alternatives. So let's get started. We'll really talk about some of the things and issues that have been important to us. And let's see if I can get this slides working for us. I've got these slides that are certainly available. I think many of you may have them already. If not, you will be able to get them. Just as a kind of reminder, I'll follow some of it. Maybe I won't for some of it. But we'll also have the opportunity for some of you to ask questions when I finish the talk that I'm going to do. So let's start with what we know about domestic violence as well as about human beings. We like to be in control. And when we have such a crisis like the one we're currently dealing with, but it's true for any crisis that's out of our control, things make our life different. And when we're that different, it makes us upset. So the first thing we have to do is to help ourselves and help everybody else try to find out what we can do to control it. And we do have some controls. You've probably been listening to a lot of them. Get enough sleep. Wash your hands at least for 20 seconds. We all know new nursery rhymes and things we can say to them. Eat well. Our lives, my life and Dr. Shapiro's life, we tend to have our life revolve around meals, breakfast, what's for dinner, what's for lunch. And follow new routines. Your old routines are probably not going to be useful, but we can follow new ones. And we need to learn what they are, what things are sort of recommended to do, but also find some that are comfortable for you or help your client find some that are comfortable for them. Uncontrolled stress produces anxiety, and uncontrolled anxiety can turn to anger and abuse. I've recently learned that 3 times the number of reports of domestic violence have occurred in China and in France and other European and now South American countries, as well as in our country. So we know it's taking place, and we really want to try and help protect people as best we can. The first thing I want to talk a little bit about, and you might want to explain to your clients as well, because you probably know this already, is that fear is the emotion that comes from these kinds of threats and dangers, especially ones where we don't know much about it. Fear is an important and very legitimate feeling. It's okay to be frightened. And when we're frightened, we often have a physiological response. People who are trauma survivors may perceive danger faster than other people, and that makes them more nervous, more anxious, worrying even more. So we want to try to calm that hypervigilance down a little bit and reduce fears by taking those precautions that we've been talking about. Of course, the one that has been recommended may be the one that makes it most difficult for the people we're talking about, and that is social distancing or self-isolation. Yes, it can reduce fear, but it also can put people who are in intimate partner relationships that are abusive into greater danger. So there's a lot of anxiety associated with fear. In fact, the physiological responses to fear and to anxiety are almost the same. So how do you tell the difference? Well, some of it is what you talk about. For example, if you think, what if something happens? That's anxiety. If you're talking about the virus is here, that is fear. So what's current, what's present is okay, but the anticipation, oh my God, not only is the virus here, but what if I get it, or what if my family gets it, or. So that's the worry that happens, and we know the more you worry, the more unproductive it's going to be. Now, anxiety isn't always bad. You know, anxiety can produce good energy. It motivates us, it gets us doing things. So the goal is to control the anxiety because we don't want uncontrolled anxiety. That's what leads to abuse. So we're going to spend a little bit of time talking about how to manage anxiety. And I know that many of you know all of this, but I tried to make it simple so you can use it to tell your clients, or some of you are going to need it for yourself. I know I get anxious at times, and I have to talk myself down from too much worry and anxiety as well. So here are 5 ways we're going to talk about it. 1, we're going to talk about how do you gather accurate information. Because remember, the more accurate information we have, the more in control we're going to feel. The second is how do we avoid triggers to our anxiety? All of us have certain triggers, and of course, our intimate partners often know what those triggers are. The third, how do we regulate tension levels? Can we regulate them so that we decrease it when we get too tense? The fourth is to find a safe place mentally. I'm going to also talk under number 5, where we're going to make a plan about how to find a safe place physically. So let's see how to do those 5 things. The first one I talked about is about gathering information, making sure that it's accurate. Too little information, if you shut yourself off or if you have some denial, you're not going to know what are the good things to do in your new routine. But too much information is going to make you crazy. It's going to confuse you. It's going to make problems. And you don't know who to believe. My suggestion, read the CDC bulletins, and sometimes in your own community bulletins that talk from medical knowledge, not politicians, not the political knowledge. You may also, for those of you who are NSU alums, you may want to go on the NSU website and look at what's put up there. My understanding is that's pretty accurate as well. If you feel like you have an overload of information and you just can't hear it anymore, which is where Dr. Shapiro and I have gotten lately, we don't listen to the late news before we go to sleep anymore. We pick one reliable source and we listen, one view presentation per day. That's enough information. Most of us already have what we know, what we need to know. The second point is to avoid common anxiety triggers. One of the most important things I'm going to be talking about today is to really up your sensory awareness. Many of us do that anyhow, but deliberately pay attention to your senses, all the sounds around you, the aromas that come forward. You know, many of you know I like aromatherapy. I think baking bread sometimes and filling your house with that kind of aroma really can calm you down. Look at colors, the bright colors, rather than only dull ones. And touch. We can't touch other people, but we can touch things. Find some tactile kinds of things, soft things, pillows, stuffed animals if you have them, things that you like. A lot of people are looking at flowers online or looking at this wonderful tour of the botanical gardens in New York on the new orchid exhibit. That's just lovely. Now, try not to generalize. Don't use terms if you can, avoid them, like always or never. Those kinds of things sort of put you in a box. So try to, not say, oh, I'm always going to be like this, or I'm never going to have the life I had before. We don't know what's going to happen. So try to be a little bit more optimistic. When you talk to your intimate partner, if you have one, or other people, use I statements. Even if you're talking on Zoom or if you're talking on chats or whatever way you do it, you do the new kind of talking, if you will. Instead of saying, you did this, or when this happened, you did it to me, try to say things like, well, I feel this way when that happened. It's less accusatory. Most of you know this, but many of our clients, they may have known it at one point, but when you're under crisis, you forget all of these kinds of things. And so, I invite you to help them remember them again. Be in the present. Try not to bring up old hurts. It's easy to do it, especially if it reminds you of something that ever got really resolved. And try not to respond to gaslighting. Gaslighting is the technique that many batterers have learned to use, that try to make the person they're gaslighting perceive that their reality is not real. They try to make them think that they're crazy. And they say that using the terms as well. So try not to respond to, or have your clients not respond to that kind of gaslighting. You put your keys down and you walk away to do something else. You come back, your keys are gone. You turn to your partner, you say, did you see my keys? I thought I put them there. Your partner looks at you with us straight in the eye and says, I don't know what you're talking about. Okay, you walk away thinking, where could it be? You come back a few minutes later and boom, there are the keys exactly where you thought they were. That's gaslighting. And try not to feel the same kinds of feelings that your partner is feeling. We're calling this now co-regulation, and we're learning more about how when your partner feels something, you start to feel the same way. And that's what happens when anxiety, he gets anxious, you get anxious. He gets more anxious, you get more anxious. And all of a sudden, tensions start to rise. So try to check yourself if you see that you're trying to match. You don't do it consciously, of course, but all of a sudden, yourself raising your voice when you weren't raising your voice to start with. That's co-regulating feelings. So now that we have some of the basics, we're going to talk a little bit more about how to raise or how to regulate rather our tension levels. And to do that, I've asked my partner, Dr. Shapiro, to come in and help us because he's going to help demonstrate some of those tension levels. How are you, Dr. Shapiro?
Doing fine, thank you.
Great. So we're going to start by the first exercise. We're going to start by paying attention. How does our body feel stress? So we're going to learn how to create body tension with exercising our muscles and then feel how it feels to decrease tension when letting it go. Now, many of you have used this as a relaxation training exercise, but we're not going to do the whole exercise. We're going to do a very simple one that's easy to do when you're using Zoom. So, Dave, I'm going to ask you how you feeling?
Okay.
Good. Now I want you to feel some tension. So I want you to tense up your muscles. How about taking your hands and squeezing them? Do it for a few seconds. 1, 2, 3. Okay, now I want you to hold it and I want you to take a deep breath. Breathe in and let that tension go. Feel it leaving your body. Are you feeling a little more relaxed?
Sure.
All right. Do you want to try it again?
Sure.
Okay, let's do it again. Tense up. Squeeze those arms, those wrists, hands. Count to 3. 1, 2, 3. Now take a deep breath and let it go. All right. You ready for another?
Sure.
All right. We're going to do another one. This one, I don't want you to use. I invite you not to use it for anybody who has a domestic violence relationship.
Lenore,
But
you want to put him in the picture? Put David in the picture.
Oh, David, come in. Move a little closer if you can.
Okay.
Okay. All right. So in this one, it's an old, ancient ancestor tradition. It's Buddhist, Taoism, and it's called Feed the Tiger. So remember, we're not going to use it for domestic violence, but you can use it for yourself or for others. So we're going to make a picture of what's upsetting you. So what's upsetting you these days, Dave?
Coronavirus.
Okay. Do you remember what it looks like?
Vaguely, I've seen it on television a number of times.
Excellent. So I want you to hold that picture in your mind, and I want you to make believe that you have drawn it on this piece of paper. Okay? Now, I want you to take your hand and I want you to smash it.
Actually, like,
Well, not too hard, but all right. Now you can continue to do that. Does that make you feel any better? You're smashing it.
yes.
Okay. All right, we'll move to the next one. But remember, it's something you can do if you're getting upset, and it's something that people who are in intimate relationships can do, but not for domestic violence people. Okay, let's do another exercise. Okay, this one comes from EMDR people, and we call it the butterfly. So, Dave, I want you to make sure you're in the picture, and I want you to cross your arms across your chest. Good. Now I want you to take your hands and I want you to put them on your opposite shoulders, your right hand on your left and your left hand on your right. Excellent. Now I want you to pull up your arms and pull them out a little bit, and I want you to fluff them like a butterfly. Do you feel like you're being a butterfly?
Yes, indeed.
All right. Now, sometimes people like to sing a little song or hum something along with it. Now, your elbows may be getting tired, so drop them a little bit. And now, tap your shoulders. Excellent. And do it in whatever rhythm you want. Okay, you can stop. How do you feel?
That's good.
All right. So now we have 3 good exercises to do. Are you ready to go and do them?
Oh, yeah.
All right. Well, thanks a lot.
Okay. Thank you. Thank you, everybody.
It's great to have an intimate partner who we're sharing all of this anxiety and tension and new routines. Fortunately, we're lucky. We have a large apartment, and Dr. Shapiro has his own man cave that he can go to. I have my own area that I can go to. So we have been very fortunate. A lot of people have a very small space and they don't. In a few minutes, I'm going to talk about how we can use those small spaces as well to find a safe place. But let's go back to a little bit more on anxiety. One of the most difficult parts of anxiety these days has been that it interrupts people's sleep. It does it in two different ways. The first way is that people can't fall asleep. Their mind just won't stop going. Of course, it's usually worry that keeps it going. The second way is that you wake up in the middle of the night and you can't get back to sleep. That's been happening to me a number of times as well. So we have to find a way to stop those thoughts and release some of that physical tension and the worry. So here's another exercise. I call this the body scan exercise. And I invite you to teach this one to your clients as well. So the first thing you want to do is to become aware of the sensations in your toes, in your feet. So let's start with our left toe and wiggle it a little bit. Now, many of you may be wearing shoes. I'm at home, and many of you may be barefoot as well. But wiggle your toes. Are they cold? Are they warm? How does it feel to wiggle them? And then wiggle the toes on your right foot. Switch and feel those same sensations. Then go through all the different body parts, going from your toes all the ways up, through your legs, through your thighs, through your abdomen, through your butt, all the ways up through your chest, through to your arms, and then up through your head. By the time you get to your head, feeling all of those sensations and telling them to yourselves internally, you probably feel pretty grounded and ready to go to sleep. If not, repeat it again. It should take less time the more the person does it. So it is a good exercise to try to clear your head of all those worry thoughts and instead concentrate on your own body and your own sensations. Okay, so we've got some good exercises now that you can use that really get you moving a little bit. Let's go and find how we find our safe place mentally. Again, many of you have done things like this, but we're going to simplify it a little bit. And we can do this over the Zoom or internet or whatever platform you're using to talk to your clients. And have them think about a very pleasant, calming event or a place that they've gone, something that really makes them feel good. And then have them mentally create that image. And as they're creating it, have them focus on the sensations. What do you hear? What do you see? Are there colors? Are they vivid? Are they not? If you're outside, do you feel the wind? I love to be out at the beach. I feel the ocean spray. Of course, we can't go to the beach these days for those of you who are not in Florida, but you can still feel it in your mind, If you're inside, are you warm enough? For those of you who are in the cold weather, although it's turning spring, but you still want to be in a pleasant place. Or maybe you can, in your mind, remember what it felt like to be inside your warm, toasty house with a fire going, and you're looking out at the snow, feeling toasty warm. Whatever image your client feels good about, maybe have 2 or 3 of them and memorize that scene. Go over it again and again and again. Because when you start feeling panicky or when you start getting anxious, switch immediately to that safe place mentally. Go there right away. That will calm down panic if people can do that. So that's another exercise. Put in your toolkit that you can use when we're working with clients. So now we're going to move to making a safety plan. You know, whenever we deal with people who have been involved in intimate partner violence or domestic violence, we always want them to make a safety plan. I'm going to give you 2 parts to this safety plan today. The first part, we're going to be able to develop a daily routine with enough sleep and nutrition and exercise for everybody. So if you want to use it, it may be something you can use as well for yourself. Pay more attention to your sensations in this new daily routine. Touch, taste, sight, smell, hearing, movement, and even the proprioceptive of soft touch, you know, not just touching something flat, but really touching it. And anticipate when you or your partner are going to need a timeout to reduce all of the things that are building up. So you want to be able to activate a timeout period very quickly. So you have to figure it out beforehand. What's the best way to do that? Well, I would suggest that no matter what the size of the place that you are sheltering in is, you can find a corner, a chair, something that you will feel comfortable in, that you want to be your time out, so that when you start feeling your anxiety, you can go there. Some people want it to be a different room if they have a large enough apartment. Some people like the bathroom. Close the door. Whatever it is, find it and communicate that to your partner, and suggest to your partner that he or she find also a safe place that's different from your safe place, of course. And then communicate a signal, you know, figure something out that will be a signal that I'm going to that place. It could be a hand signal. Sometimes I used to use the hand signal like a little C, backward C, for control. I used it because once you get your hands doing something else, they're not going to strike out to hit. So it can be useful in a domestic violence situation. But any sign or any word, if that helps, that signals you're going to go there. And then some way to create a signal about how long you're going to stay. So maybe 5 minutes, maybe 10 minutes. And then if you need to renew it, do it again at the end of that period of time, so that you are communicating, but at the same time, you are taking the time to get inside yourself, pay attention to yourself and your own feelings. And while you're in that safe place, most important is think positive thoughts. Maybe it's the exercise we just did about your safe memories. Or maybe you're doing some of the exercises that Dr. Shapiro and I did together. Whatever it is, make it positive. Make it upbeat. Because if you don't, you're not going to get back to a safer spot in yourself internally. Now, if these suggestions are not working and the tensions are escalating into a domestic violence incident, call the domestic violence hotline. I have several numbers that I put on this slide, and I'll give them to you again for those of you who want to see them or put them in your phone. We have the U.S. hotline, and we have a hotline for here at Women in Distress and the Broward hotline. So make an escape plan. You may not be able to write it down. If you can, that's great. Draw it where you are, from one room to another room. How would you get out? If there are children, try to give them a clue so that they know that they have to go with you if you're going to go. Or if it's a baby, grab the baby and go. So that'll be in your escape plan as to how to work that out. Why do I say that? Because if this escalates to any kind of court battle, and domestic violence courts are in session, folks, so they are available. if it gets to that point, at least in some places they're available, check your own community. So if it gets to that point, you don't want the judge to say, well, how could you have been in that much fear of your child, and what your partner might do to your child if you left the child there. Now, sometimes you cannot help it. You have no choice, and you have to explain that to the court. But if you can, take the child or children with you, and know where you're going to go. Usually, if you have a car and you have car keys, that's a good place. Otherwise, notify a neighbor, notify somebody in the family, or just get out of the house. What's happening in some of the other communities and in Europe is they're going to pharmacies, and pharmacists have been trained to have a Q word. And if you come in and you say, I need medication, I don't know what the Q word is, but we'll have to find that out. Then they know to call the police. We were doing this with pizza at one point, ordering pizza, and if you gave a clue, a Q word to that, the pizza place that you called would call the police. At any rate, beforehand, be prepared. Invite your client to pack some money, pack a little suitcase, and leave it by the door. What should you have in it? Well, you should have some money. You should have some necessary papers, maybe school things, birth certificates, marriage certificates. 14 days supply of medication. At least you'll have that. Your keys, the house keys in case you want to get back in, car keys. You may want to get a change of clothing. I don't want you to do too big a bag, but maybe a warm sweater, or if you're in a cold climate, a jacket or something, in that bag near the exit. Have it as close to the exit as possible. You can talk about it being a hospital bag in case I get sick and I have to go to the hospital. But get that ready so that you don't have to think about that in the middle of the crisis. And then go, as I said, to a safe place nearby. Grocery stores are open now. Courthouses in some places, not in others. Police or fire stations, pharmacy. Find the nearest place. Maybe you know a near battered women's shelter. I'm giving you the main line to women in distress for those of you who are located in Broward County. But in wherever your client is, maybe they can find the number of a shelter and put it in your phone. Put all these numbers into the phone. And keep that cell phone charged and near you at all times. If there is a domestic violence act, please urge your client to call 911. The police will be there. It's best to really stop it right away and make sure that this does not escalate even further. So here are the hotlines. The hotline for the United States, across the United States, is an 800 number. My understanding is that they're there 24/7 now, is 800-799-7233. I'm going to put it up on the screen so that you can see it. It's 1-800-799-7233. Let me say that again. 1-800-799-7233. If you're in Broward, the Broward hotline is 954-761-1133. Those 2 3s at the end. Again, Broward's hotline, 954-761-1133. If you want to talk to women in distress at the shelter, the number there is 954-760-9800. That's 954-760-9800. And if there's an incident, call the police. 911 is usually the best way to get them. Some communities you have to call another number. So encourage your client to find those numbers in advance and put them into their phone. So all they have to do, I believe some cell phones actually do have a special place where you can just tap it and it'll go straight into a local police. But some people live in areas where that isn't going to be possible. So with that, I'm going to urge everybody, wish you the best. Stay strong, stay safe, follow the rules as best we can, and we're going to get through this crisis together. So thank you for being part of us, and we're going to take some questions now. I think, Carlos, you're going to read some questions for us?
Sure, and questions are starting to come in. We've got a question from Karen. Good morning, Dr. Walker. How do you approach patients that are fearful of telehealth phone call sessions because of spouse being home, able to hear no matter where they are in the home?
Well, that's a very good question and something I hadn't actually thought about. I think the most important thing is not to bring up the kinds of issues that might trigger the spouse's anxiety. So try to stay away from certain topics. If your client raises some of them, you can suggest to them that it would be a good idea to put that aside and talk about it at another point. I would also remind everybody that one of the most important things to do when you're working with somebody whose spouse is abusive and is present is to try to keep them calm by repeating to your client, not about trying to leave, but rather trying to stay safe. The most important thing is you're not wanting to break up their relationship. You want her to be safe. And sometimes to stay safe, you have to take a time out and maybe even bring the spouse in to talk about how to take a time out in the house, as we went through earlier. Good question.
So another alum has asked, are there any apps you recommend?
There are some apps. Thank you for bringing that up. There are some on cell phones. In fact, some of the best apps that I've been looking at with my PTSD task force have been on the Veterans Administration websites. They have a number of different apps that are good, but there are also some easy apps on meditations, on exercises, simple ones that we went over as well. So you can look at them up yourself and then suggest them to your client. Very good.
So one of our friends has asked, are there resources for the Spanish-speaking community? I would also add Portuguese and Creole. Do you know if there's some resources and places people could call?
I do not have phone numbers directly. I do know that I'm pretty sure that Women in Distress here in Broward do have Spanish speakers, and they may also, because we do have a Brazilian population, they may also have some Portuguese speakers. But I would call the hotline, the national hotline that I gave you, the 800 number, because they would know, and I'm sure that there are those kinds of resources, because now that everybody's online, those resources would be there as well.
After their questions, we will give people the opportunity to share resources, and you will be able to chat with all. Another question you have, in your experience, do these techniques work with perpetrators of domestic violence? Well,
I think some of them do. Don't do the one with you hitting the tiger with them. We don't want them to do that. Some people actually use those old Bataka bats where they used with perpetrators, but we found that only made it easier for them to hit and use physical aggression. So we don't want to use that. But I think some of the ones that try to release some of the tension might well work with the batterers. I've not tried them, but you may want to.
Great. Another question is, does 911 have tracking ability in Broward?
My understanding is that it does have tracking ability. I know that there was a point where it was difficult to track on cell phones, but I think I'll have to check that out. You may want to check it as well. And in some places, it does not have tracking on cell phones. I think all landlines, there is tracking abilities if they have a 911 designation number.
Next question is, what are some resources you recommend to educate clients about domestic violence?
Well, there are websites that clients can go on if that's safe for them to go on them to read about domestic violence. I don't have the actual websites, but I think if you Google domestic violence, you'll see a whole lot of them are going to come up. And you can use that. Of course, if those of you who worked with me on domestic violence or domestic violence research at NSU, you may have some of those resources as well. We have a wonderful program called the Survivor Therapy Empowerment Program, or the STEP program. We're actually working on the 3rd edition, and I suspect it's going to get done now that we're all stuck at home, sheltering in place, I should say. But we're also translating it into Spanish because several of us went to Costa Rica, and we've been working in Colombia and in other countries, Puerto Rico, where we have a lot of Spanish speakers. We haven't translated it. We started to translate it into for women in Jordan, but unfortunately, due to the virus, that visit was canceled. But I think we have somebody who's working on that. And anybody who wants to help us translate, please send me an email at walkerle@nova.edu, and I'd be delighted to have you work with us. We're going to set up a whole Zoom group or go Canvas group, I'm not sure which one, to work on it.
And we'll send a couple of follow-up emails to our participants and also even people that registered, so we could share some additional resources. Another question here. What do you suggest to say to clients who dismiss the usefulness or helpfulness of calling the domestic violence hotline? What are they going to do for me?
Well, I would certainly talk to them about saying that you can get to talk to somebody, and they may have some suggestions beyond what you're able to give them. That they work with people every day who experience domestic violence, so they may be able to help you. Maybe not, but I usually say to clients, isn't it worth a try? The goal is to stay safe, and we want to find as many ways as we can be safe. And so that's how I would put it to them. And if they're resistant, I would just tell them, think about it, take the phone number down, and you may not need it now, but at some point you might. And so have it. You should be prepared.
So we've got a wonderful question from somebody in the Bahamas. Good morning, Bahamas. It's so nice that you're joining us. She's an alumna of the Mental Health Counselor Program. And she's asking, do you have any specific questions for children witnessing domestic violence?
I'm going to have to do a whole
shelter.
Yeah, I'm going to have to. I'm sorry, I lost the last part. I started answering too quickly.
So, witnessing domestic violence, who are unable to seek shelter due to limited resources, lack of shelter.
I can only I can't imagine. I can't imagine what you're going through in the Bahamas, given the horrible, horrible hurricane that devastated so many parts of the Bahamas. So I know so many people were doubling and tripling up in homes that were safe because their homes were destroyed. And so for you, you probably can tell us what you can find and what you can do. I want to do a whole webinar on children because I think it's not just women who are being abused, but it's also children who are having a struggle every place in sheltering in place. In my own community, we see them come downstairs and go into the swimming pool or run around the courtyard. They need exercise. It's not natural for children to be cooped up. Many of them are going to be busy. Some of them are on holiday right now, but many of them are going to be busy with some schoolwork. But what if they don't want to do the schoolwork? That's going to get tempers going. So I would say right now, you need to try to be as pleasant as possible with the children and try to find something nice. I've always tried to say, find one nice thing that the child is doing today. Maybe it's what they chose to wear, maybe it's the smile that they have, maybe it's some drawing that they did, something, and try to make them feel good. Try to make them have a little bit of control as well, because they're feeling like their world has been devastated too.
Next question, and we've got lots of wonderful questions. What do counselors do when a client lives in a rural community where a safe house is 15 miles away from the house?
Well, make sure you have car keys for sure, because you may have to drive those 15 miles. When I lived in Colorado, we had safe houses that were sometimes 50 miles. And what we did was we had a whole safety network of people who could drive you 25 miles. And then there was a checkpoint at that 25-mile post, and another person picked it up and drove another 25 miles until you got to wherever the shelter was. I don't know that you can use something like that right now because everybody's supposed to shelter in place. So my suggestion is there must be some place where you order medications. That's why the pharmacy was a good place, a grocery store, and then make the phone call to the shelter and see how they're arranging it. Maybe they've got a driver network set up.
Next question is, how do you get the abusive partner to be part of the therapy without them feeling as though they're in trouble or part of the problem?
Well, they are part of the problem, so I'm not sure you can make that different. But you don't want them to be in couples therapy. Couples therapy is definitely not good. But if you're going to be doing treatment with the woman, you may want to try to find some treatment for him. If he can't get into batterer's treatment group of one sort or another, if he refuses to do that, maybe you can teach him a couple of exercises, like we did with Dr. Shapiro. Just some simple ones, because I'm sure he's feeling tension as well, and feeling like, you know, batterers need control. Domestic violence is about a loss of power and control. So we want to give him some control that hopefully will work. We'll see.
So we've got quite a few questions here. So about how many more would you like to take?
We can do another few.
Okay. Should I Stay or Should I Go is a book I often use with survivors. That's a comment. And
yeah, I don't know the book, but I, at this point, given the fact that we're all in crisis, my advice would be to stay as much as you can in where you are, because the more disruption, the more crisis. And so many places are closed now. Hotels are closed. So it's difficult. That's why I emphasize trying to find a safe space in your home.
So this question is a little similar to one you answered already, but it's a little different. What are some ways to attract perpetrators of domestic violence for coaching or therapy?
Again, perpetrators are not just one type. They come in all sizes and shapes and demographic groups, just like battered women do. And so to give one answer to that might be wrong, but I'm going to divide them at least into two groups, I think. Let's try that. So the first group are going to be those perpetrators who are somewhat reasonable, who the woman is able to talk with, who often can calm him down. And for those perpetrators, I find one of the useful techniques is to be able to say, look, we both want to be safe. We both want to get through this crisis together. So let's find a way that we can recognize that when our tensions and anxiety are going up, and let's find a safe spot in our house. If you can do that, you will probably be able to engage him and teach him the signals, 5 minutes, 10 minutes, and that we got to think positive thoughts. If you can do that much, for I think a large number, we're going to keep them a little bit calmer than otherwise. Some of them, however, are already at a very dangerous level. Those people you try to do something with, they're going to really react badly. And so for them, I suggest that the woman try to think about what works, because she knows better than we do what will work to keep him calm. That's the goal. As long as you have to be in shelter in place, we need to do that. Now, this doesn't mean that we want the battered woman to always have to keep him calm. When we're back into normal society again, out of crisis, we're going to teach her something different. But this is a place, a gap, and we want to at least do what we can to get through. It's probably going to be another 4 to 6 weeks. We need to get through that period. And so that's what we're trying to do right now. But it isn't the way we would do it necessarily when we're out of crisis. That's why I labeled this webinar as one for intimate partner relationships in crisis, because some of these things might work when you're not in crisis, but some of them may not be necessary then.
So should we say the last question?
Okay.
And there are a few more, and I'll stay on a little bit that we can handle a few more.
Yeah, I could do a couple more.
This is a pretty interesting one because they're asking, and actually I want to answer part of it. Are there any studies currently being conducted or slated to begin targeting domestic violence perpetrators or victims that are open to those who are interested to be a part of, if they're not in a graduate program? And one of the things I have to mention that you did create a graduate program here in forensic psychology, which is something that would be wonderful for people to consider so they can master in this area. But do you know of any research, or are we?
Well, I want to give a plug also, Carlos, to the fact that we have a scholarship for people who are interested in studying domestic violence and in forensic areas. And
we seeded that scholarship, and we created an endowed scholarship together.
I did, and so if anybody is interested in helping some people I'm sure who are on this call have been out for a long time and may have some extra few dollars that they can contribute. That would be terrific. There are some, I don't know of any actual studies right now, but I do know that there will be some coming. I've been on some APA listservs, and those of you who are APA members, check. I know the trauma division 56, the trauma division is talking about doing some research. Division 43, the family division is talking about doing some research. Why not do your own? Start collecting data. Be good to have.
We have a comment, somebody's requesting a comment on children. Can we teach a child safe place image and a safe place physical to go in home?
Yes, I think we can give a child a safe place as well. It's harder to do it with children because they often feel like they're in timeout. So, maybe do something fun, maybe make signs and put it on a chair or something and say, this is your safe chair, this is your timeout chair, so that you can differentiate them with children. Just something I'm thinking about. I think, Carlos, we're going to have to do one on children, keeping children safe.
I'm happy to do that with you since I've already been bugging you to do a few more. Next question is, at what point do you determine an escape plan is needed, and what does your escape plan consist of?
Well, I would use the escape plan that I talked about here. You have the slide, that last one that says have some things packed in advance and make an exit strategy so that you draw the plan. They're up on the website too. There are a lot of different safety safe plans or escape plans. So if this one doesn't work, you can use some others.
And let's see, we had a message.
In terms of what point, when you feel like you're scared, if you can say to the man, I'm scared and I've got to leave for a few minutes or for a little bit of time, I'm going to come back, we'll discuss it. But right now, I need to calm down, and I hope you will calm down as well.
I think I've gone through most of the questions here, and there's a couple comments. People are asking for follow-up for PowerPoint slides and those things. You're gonna get an automated message, and then we will do a follow-up email as well.
Well, this has been fun. I hope everybody is going to be safe, follow whatever rules you're supposed to follow, stay strong, get enough sleep, get enough nutrition, all the things we talked about. And I look forward for us all getting together again, hopefully when things are better. I know some alums have sent me private notes saying, that they've been excited to be able to reconnect, and I feel the same way. So again, I want to thank you all for being with us today, and I look forward to further emails, further webinars, and keeping in contact. Bye for now.
Thank you, Lenore, and I really want to thank everybody for joining us this morning. Please keep in touch. If you have friends that are alums, please encourage them to send their email addresses to psychology@nova.edu. And also, you'll notice I'm wearing a little pin here. This is a custom College of Psychology pin with a little rhinestone on it. And if any of you would like this piece, you're going to get a little email and it'll tell you how to get this. Thank you so much, and please encourage your friends to join us in the future. We will be having similar events within this month and the month of May, some very exciting events where you can see some of your faculty that you worked with and also connect with current students. My name is Dr. Carlos Perez. My email is perez@nova.edu. Please keep in touch. Thank you.